And good morning. It's April 22nd, 2025. In 2 days, there will be the April 24th, which is the annual commemoration of the Armenian genocide, which occurred in 1915. There were 1.5 million Armenians murdered by the Ottoman Turkish Empire. The Ottoman Turkish Empire in 1915 went to Armenia with soldiers and basically murdered 1.5 million Armenians. The rest that could fled and tried to get away. It's 2 days from now. I won't be doing surgery then. I will be actually traveling to a meeting for neurosurgeons that is being held every year. This year it's in Boston. And this is the annual American Association of Neurological Surgeon meeting that I'll be going to. Okay, this patient is a patient who suffered for 30 years with chronic back pain, and he comes now to Duke Spine to have it fixed. 30 years of back pain, poor thing. He's completely debilitated from it. He's from Florida, and he's tired of living in pain, so he decided to get his back fixed with the DLDR, Duke Laser Disc Repair. All right, we're going to be doing a right L2-3, 3-4-4-5, and a left 3-4-4-5. All right, I see 5-1 down there. I'm aiming for 3-4 on the right side. So I'm just going to place these 5 needles there through the skin and go directly to the herniations that we're going to fix. You can see the first needle is in really good position, and that's the 5-4-3, 3-4 disc. AP. Now, we're going to get an x-ray. AP is front back. We're going to verify the position of the needle tip. I already know the entry point, and it's perfect. You can see that right there. So if you have questions during the surgery, feel free to type them up. We are streaming live on LinkedIn, Facebook, and X, and YouTube. You just didn't drop the fluoro. You got to drop it. All right, now, Henry, let's show the audience these 30 different causes of back pain, because there's 30 things that cause chronic back pain, and Duke Spine Institute has a cure for all 30. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. So our video has shown the audience that's watching that there are 30 specific causes of back pain, and every patient has their own combination of those 30 causes. The most common is a disc pain, disc injury that causes pain, and that is either a herniated disc or a bulging disc, ruptured disc, protruded disc. They're all the same basically. It's a disc injury. All right. We've accessed the 3 discs on the right side. Now I'm trying to get to the left side where the other discs are, and I've already gotten the needle into one, but I have not gotten the needle into the others yet. So why am I placing needles? Well, the needles are going to guide my surgical instruments. Remember, this is endoscopic surgery, Sean. And endoscopic surgery, endoscopic surgery requires the use of an endoscope, Sean. And to use an endoscope, you first have to place a tube, all right, a tube. Sean? So I have to get a tube in here. Please remove the top half of your X-ray field with the collimator because you're radiating my hands. Okay? I didn't say shrink down top to bottom. I said remove the right side, which is the top. Well, where do you think my hands are? You think they're up there in his spine or maybe down by his ass? All right, it's too much. I need to still see the needle. And the disc is the most common cause of back pain. That's this patient's problem. He's got bad discs causing his symptoms. We're going to go fix these discs, and he doesn't just have back pain, he's got leg symptoms. He's having weakness in his legs. Man, I might have to just come with another incision. Shot. If you have questions, feel free to type them up and I'll answer them to the best of my ability. But I want to just talk for a moment about those 30 causes of back pain. It's important to understand that the average patient with chronic back pain has four causes. Shot. And this patient has 3, which are his 3 discs. But because he has pinched nerves on both sides, I think I'm hitting his iliac crest, that's why. Let's get a shot. AP. He's got a little bit of abnormal bone formation around the facet joints on the back of the spine. It's kind of blocking my needle. So I'm having to pick a different trajectory. You can see the crisscrossing of the needles at L3, 4 disc. I'm hitting his iliac crest. Shot. That's better. Any questions? Sean?
At this moment, no current questions, so we do have a comment coming from Lioness Blessings on YouTube saying, thank you, Doc.
Yeah, you're welcome. My pleasure. So yeah, this patient has had, we're going to show you in a minute. Is he almost ready?
Yeah, ready.
For a discogram. Good. He's had 30 years of back pain. 30 years. Okay? AP, shot. And AP. He's had 30 years of back pain.
How you doing, my friend? You okay?
The back, AP, the back pain has
You're doing great. Don't move
basically
Doing great. Don't move.
completely destroyed his life by taking away activities that most of us do without any thought about back pain. But people with chronic back pain, every time they get active and do things, it sets off their back pain. It makes it hurt more. And he's no exception. So he's lived with this debilitating condition of back pain and now pinched nerves going into his legs. And that's what we're here to fix today. So we're not just fixing back pain today, we're also fixing weakness and numbness in his legs. All right. Well, you can see Monica will show you. Show us the L5-S1 disc, which we're not operating on. Good. Show us the L4-5 disc. Yes. 3-4. Yes. 2-3. Yes. The 2-3 we're only going from the right side. Now, his back pain, when I asked him, is located in this area. Okay? And what he has here is 3 discs that are damaged. He's actually got a 4th disc that's damaged further up, but we could only do 5 spots at a time. And these discs have tears. This is the L4-5. Is he ready?
How you doing, my friend?
L3-4.
All right, we're going to ask you some questions.
Are you having any pain?
Are you having any pain in your back right now?
All right, so he's awake. I told him earlier we're going to wake you up for a couple of minutes just to test your discs. Are you having any pain?
Are you having any pain right now?
It's yes or no? No?
That's what I need over
All right. Okay. All right. Yeah, we made a little cut there so he can feel the cut, but even though we numbed it up. All right. Good. How bad is that on a scale of 1 to 10? How high? 10. Is that where you get back pain?
Yes.
All right. We got 10 out of 10 at L4-5. It's concordant. Folks, I just tested the disc at L4-5, and as soon as I injected a little bit of the liquid into the disc, which you can see on the x-ray there is leaking out through a big tear in the back, that is the posterior annular tear that's causing his back pain. But as soon as I injected a little bit, like immediately, his back arched up and he said, that's where his pain is. So he has 10 out of 10 at L4-5. Is that better now?
Is that better now?
Are you having any pain?
Any pain now?
So we just verified that the L4-5 disc is the cause of his back pain. You hear that? Did you hear it, Henry?
My friend.
Yes, we did.
How high did that go?
20.
20. All right, I'm sorry about that, but we verified that your L3-4 disc is causing your back pain. Is that where you typically get back pain? Yeah, all right. I'm not injecting anymore. It's okay. So we're fixing 3 discs, L4-5, L3-4, L2-3, because my Duke spine exam, it's called the Duke spine exam, which is where we make the diagnosis of what causes somebody's back pain or neck pain. My Duke spine exam told me that the L4-5, the L3-4, the L2-3 were the causes of his back pain. And I just confirmed that with this discogram. It's called an evocative discogram. How bad is that on a scale of 1 to 10?
How about is the pain? 10. It's just 10.
10. All right, the last disc, 2-3, is a 10 out of 10. Is that where you get your pain? Yes? All right. So all 3 discs that we are operating on today with the Duke laser disc repair are painful with 10 out of 10, 20 out of 10, 10 out of 10 pain respectively from L2-3, L3-4, L4-5. We're going to get started. We've got a lot of work ahead of us. But remember, we are not just treating back pain. We are also unpinching his nerves going down his legs to get the pressure off those nerves, because the tear and herniation is literally crushing the nerves. Let's get started. Any questions?
Yes, we have a few questions. This one coming from Tom on YouTube.
Let me know when I can proceed.
Asking, do you foresee the insurance companies approving your surgeries anytime soon?
Great question, Todd. So Todd's asking, do you see the insurance companies approving this procedure or any of our procedures anytime soon? The answer is yes. So we do get insurance companies approving and paying for these surgeries. The problem is we don't have a contract with the insurance companies to provide these services. So when patients come, we never know if the insurance will pay or not. Now we know for sure Medicare will not pay. Medicare is very selective, and they don't want to pay for anything new that works because they know that people will want to have that surgery done. So Medicare is not looking to add treatments to their repertoire of what they cover. They're looking to pay for less because the federal government's Medicare program is at risk of going bankrupt, and unfortunately, the people that run Medicare, which is Blue Cross Blue Shield, they actually get paid to deny treatments for patients. So they're not looking to add more treatments and cost the federal government more money, since Medicare is a federal government insurance plan. So the government has made it very clear, the VA hospital has made it clear, they're not interested in covering more services for patients. They want less so that they pay less. Okay? Let me finish answering. Now, we do get lots of insurance payments and coverage for these surgeries. Lots. We have over 120 insurance payments over the last 3 years. So it does happen, but the problem is it's inconsistent, and we never know if the insurance is going to pay for it. With payers like Blue Cross, Cigna, United, it's a crapshoot. And they could not pay for it. And we have no recourse because we have no contract. So we can't hold them accountable to pay because we have no contract. No, we're done. So basically, if we do the surgery on a Cigna, United Healthcare, Blue Cross Blue Shield, Humana patient, we're basically gambling that they'll pay. And most of the time they don't. So the only way to get paid would be to sue them. And they have written the laws of this country and state to make it very hard for us to sue and get paid, like almost impossible. So basically, they don't want patients getting treatments that they don't control. And since this is a treatment that works, these insurance companies know that if they start covering it, everybody's going to want this surgery. And so there's going to be a mad rush to get people's backs fixed at Duke Spine Institute, and they don't want to have to pay for you to get your back fixed. They would rather you not get your back fixed and live in pain and eventually give up and kill yourself or drink yourself to death or drug yourself to death. So the insurance companies are not interested in your health, your well-being, and they're not interested in fixing you. What they are interested in doing is making money, and the only way to make money for insurance company is to not pay for your medical care. Which is why, Henry, we've got a video we just published that talks about 850 million denials by the insurance companies for medical treatments. Now, all 850 million of those denials is not for the Duke laser disc repair. There may be a few hundred Duke laser disc repairs. By the way, that's 850 million denials a year that the insurance companies deny payment for medical treatments. So maybe 100 of those is Duke laser disc repair, or 200, but the other 849,999,800 denials every year are for other doctors' treatments that they recommend that are not covered. So the real question is not when will insurance companies cover your procedure, because they do. The real question is when will the insurance companies be held accountable by the general public for not covering their medical procedures? That's the real question. When are you going to get off your ass and go talk to your politicians and get them to start covering medical treatments that work? That's the real question. When are you going to do something about it? It's funny because I've already discovered not only the causes of back and neck pain for the whole world, but also the cures. And yet people want me to do more, like fix their insurance, like I'm a magician. I'll just pull a rabbit out of a hat for you. Why don't you get up and do something hard in life? Go fix the insurance industry in America. They're literally ripping off our country. All right, we got too much light. We're overexposed. Let's bring it down a notch or two. All right, we are now in the disc on the right side, the first one. You can see the laser fiber. It's 1 millimeter wide. And I'm using the laser to basically, remove this stuff right here. This is inflammatory tissue. That's herniation right there. You see it pop out? That's a piece of herniated nucleus stuck inside the annular tear. That is exactly why we're here. We're here for that. And for this calcification and scar tissue. All of this junk in here is causing inflammation, which is his body trying to repair this. They use the inflammatory system to do it, but the inflammatory system cannot repair it because the jelly is stuck in the tear, called the nucleus. The nucleus pulposus is stuck in the tear. Henry, did you show the video already of how a herniated disc causes back pain?
Not yet.
And how the Duke laser disc repair fixes it. Let's do that, and then we'll take some more questions.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You can see from the video that you just watched that the number one cause of back pain in the world, and by the way, there are 800 million people with back pain in the world, chronic back pain, that need this surgery. There's another 200 or 300 million people with chronic neck pain that need this surgery. So together, there's about 1 billion people worldwide suffering with debilitating back pain that keeps them from living a normal life. They're treating that back pain with things like shots, pills, alcohol, drugs, therapy, things that don't work to get rid of the pain, and yet we have the cure right here at Duke Spine Institute. Let's just say 1 billion people worldwide that need this exact surgery you're watching that was developed at Duke Spine by myself, the pioneer in this technology, and we've been teaching people about it for years. We've been broadcasting these surgeries live for 11 years now from this Duke Spine Institute. what we're seeing here is you're looking down a metal tube that goes from the outside world where we are and all the way down into what's called the annular tear, which you saw on the video is a tear in the wall of the disc that then you get a piece of nuclear material which is contained within the wall that fragments during trauma, and those little pieces start escaping through the tear. The tear is like an open door. It's allowing all these monsters to get out. These monsters being fragmented nucleus pulposus. And as these little monsters start to leave and they get stuck in the tear on their way out, because the annulus is about 2 centimeters, 2.5 centimeters to 3 centimeters thick. So they've got a journey to make from the inside of the annulus all the way to the outside of that tear. Now, a lot of them get stuck in the annulus, and as they get stuck, the body's inflammatory system sees them, not really with eyes, but it chemically sees them, and it mounts an attack on them. And that attack is called inflammation. All right, and it creates pain and swelling and redness, which you're seeing. It also creates scar tissue and calcification over time, which we're seeing right here. So this disc does look like it's been injured a long time ago, and this injury has been around for a long time. But that's what we're using the laser to remove. We're cleaning the tear, getting rid of the inflammatory tissue, the herniation, the scar tissue, the calcification, the granulation tissue, the new nerve fibers that are pain fibers that are causing a lot of pain. We're zapping it all away, cleaning this thing up. And once we do this surgery, the patient's disc will heal itself and repair itself, basically. The only thing it won't do is it will not refill itself with jelly. That jelly is made when you're in the uterus, when you're an embryo, and that jelly is what's called the notochord. The notochord is an embryological structure that basically orchestrates and directs tissues around it, stem cell tissues, to become your muscle, bone, skin, teeth, everything that you are, brain. So that notochord is very important, but at the end of that process, the notochord becomes these little jelly sacs found in the middle of your disc, from your cervical all the way to your lumbar. And it is the notochord remnant, called the nucleus pulposus, that is highly toxic to the inflammatory system. So as the nucleus escapes the avascular or non-vascularized center of the disc and starts coming out through the annular tear, it encounters blood vessels, which then mount an attack through the inflammatory response. And that's where all the pain, swelling, nerve symptoms, sciatica, that's where it all comes from. I discovered that. I'm the one who pioneered this discovery. I'm Dr. Duke Machen, the CEO and founder. And I found a way to fix it, which is what you're watching right now. So let's show the audience the Duke Laser Disc Repair Lumbar for lower back pain coming from a lumbar disc injury and herniation.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. We are currently performing laser surgery on the patient's L4-5 disc. You can see the tear. This is fat tissue up here. It's just getting in the way. That's the reason I zap it with the laser. It shrinks it down and makes it disappear. But you don't want the fat to block your view of what you're doing. This surgery requires the surgeon to actually watch and see through the endoscope what they're zapping with the laser. We don't just zap around here blindly. This is targeted treatment. So we're targeting the nucleus, the herniation right here, the blue stuff. We're targeting the annular scar tissue and calcification, all right here. And I'm just about done with this disc. This is the right L4-5, and you can see the tear right there. I've debrided it with the laser. Now there's going to probably be another needle in here from the other side. Remember, we had to access this disc from both sides, so there should be a needle down there. I want to try to avoid it with the laser. I don't want to hit it with a laser. If you hit the needle with a laser, you can melt the steel. This is a very powerful laser, and we've melted the steel of the needle before, and it makes it difficult to put the guide wire in later. Any questions from our audience?
Yes, this next question is coming from Hira on YouTube.
1 minute left on this disc. Go ahead.
Asking, can you show the axial views of the bulging discs?
No, we can't, because the view you're seeing is the sagittal view on the MRI at the bottom of your screen. We can't show you the axial views because we're not able to do that live. Sorry. Good question.
Next question is coming from Charlie on YouTube.
Hi, Charlie.
Asking, a spine surgeon made a video last week saying that endoscopic surgery is a marketing fad. He cites reasons why. One of the dangers of one was the dangers of dura tear and missing it because of the water flow. Also because of the steep learning curve for endoscopic surgery. He had other reasons as well that I don't remember right now.
Yeah.
How do you recognize / prevent dura tears?
That's a great question. Thanks for bringing it up. So the fundamental difference between what that surgeon is talking about in his video and what I'm doing is that I'm not anywhere near the dura. You see, I'm using a special technique that is even more difficult than the one that he described in his video. He described something called a translaminar or interlaminar approach, where you go from the back of the spine, and there is a big risk of damaging the dura by doing that. But this treatment I'm doing is even more difficult than what the other doctors do endoscopically. This is true endoscopic transforaminal surgery. And there is no dura to damage as long as you do the procedure right. Now I'm going to tell you, in all these years of doing this surgery, which is 19 years, I've never had a dural tear, okay, ever. And the way you know you have a dural tear is the patient will, number one, tell you they have headaches after the surgery. So it's not like you see spinal fluid. You actually have symptoms like headaches. And then you get swelling where the incision is. It literally swells out like a balloon from the spinal fluid that's under your skin. Lots of surgeons have that in their patients. We don't have that at Duke Spine Institute. We don't get dural tears at Duke Spine. It's sloppy surgery. A lot of sloppy surgeons out there. And the one who did the video, I'm sure he's had many dural tears in his career, but I do not. You have to understand there's a big difference between the best surgeons in the world like myself and everybody else that has complications all the time, like that surgeon who made the video. That's why that surgeon won't do endoscopic laser, because they don't know how to. So they want you not to get it. They don't want these treatments to become popular because they don't know how to do them right. They're going to get a dural tear if they try it, and they are basically losing business to people like me who are good surgeons who do good surgery and don't have complications. So they're trying to scare you out of this surgery. And the thing about it is that I do all the surgeries. I've done fusions, laminectomies, discectomies. I've done everything that surgeon has done, and I've done hundreds of them, if not thousands. And that surgeon does not do what we do. So here is the epidural space. Do you see any dura? No. You see fat. There's a nerve root in there. And you see the facet joint right there. That's the facet. You see blood vessels, and you see the tear that I just repaired. But you don't see dura, because there is no dura with this technique. This is an advanced technique and it's only available and done by myself in the United States. There may be one other surgeon that does it. I don't know who, but it's a very difficult surgery to do. It requires special equipment, specialized training above and beyond normal endoscopic training. So we don't have dural tears. I've done now 2,600 of these surgeries with 0 dural tears. Okay? Just so you understand, right now with this tube, if there was a dural tear from my surgery, spinal fluid would be coming up and out this tube. You would watch it drip like a waterfall. That's not happening. So that surgeon who made that video is a liar and a dirtbag and a scum, like many spine surgeons, just trying to protect his territory by instilling fear. Now, I will tell you this. If he wrote the video and said, Dr. Duke Majan would not have this complication, I don't think he ever has because his technique is so flawless. But the other spine surgeons who are trying to do endoscopic will fuck you up and they'll get dural tears like this. That would be an accurate video. All right. I'm glad Luis appreciates that, but it's the truth. How many dural tears have you seen, Luis? Never. He says never.
I've been here for years.
But what's that previous? Probably one.
No, during endoscopic.
No,
Yeah, never with endoscopic. I've had done open back surgery like fusion, and other surgeons have first done the laminectomy where they got a dural tear, and then I opened the patient up to do a fusion years later, and there's still a spinal fluid leak there, but I don't create spinal fluid leaks. Good surgeons don't create spinal fluid leaks, okay? Spinal fluid leaks, spinal fluid CSF leaks are basically bad surgeons. And there's lots of them out there. That's my opinion. Next question.
This next one is a comment and or seeking advice coming from Frank on YouTube.
Sure.
Saying one person trying to do something to make the insurance companies or politicians change, it's like one single ant trying to knock down a redwood street.
You're right.
I want Dr. Duke to be my surgeon. That's why I'm trying to get my workman's comp settled so I can get the money. They said I am permanently disabled, but I don't want that. I want to go back to work. Several ruptured discs in my back and in my neck when I fell and out of my truck. It's been 18 months now, and now I can't walk. I'm in a wheelchair. The doctor said he needs to do an L4-5 fusion.
Yeah. Well, Frank, I'm very sorry about your situation. I want to fix you. I can fix you. Come here and we'll get you fixed. You're correct. One person trying to take on the insurance industry is like an ant trying to take down a redwood tree. I agree with you. That's why we do this stream, is so that it's not one person learning the truth. It's thousands of people discovering what's really happening in America with health insurance through my videos that Henry and I produce. Henry's done an amazing job. I was just telling him about that today. He's produced some videos this last week that are phenomenal. The point is, it has to be change brought about by everyday Americans that have the ability to vote and elect officials into office that will truly represent our needs, okay? And healthcare is of all needs the greatest. Not the price of eggs, not border crossings. Yes, they're very important too, don't get me wrong. But health is our number one most important thing that Americans can have. And we have been robbed of our health by the insurance companies. That's why I do this stream. Yes, I want to teach you about back pain. But what you really need to know about is who is keeping you from getting the best care available in the world. And that is your insurance companies. They are so powerful. Look at Trump. Look at Elon, right? Doge. It's in the news. It's all they talk about. It's all everybody talks about is how these guys are investigating the Treasury Department, the Department of Education. Everything is being investigated, except you never hear them investigate the insurance companies. Why? Because the insurance companies are the most powerful entity on earth. The United States government can't even touch them. Trump won't touch them. Musk won't touch them. Nobody is touching them. And you guys are getting your health and life stolen from you. I can't tell you how many people commit suicide because of back pain that we can fix in 1 hour. It's shameful and disgusting these insurance companies get away with it. So yes, I can't fix the insurance companies, but I can raise awareness by teaching you, the public, the truth. What's really happening. 850 million denials every year by the American health insurance companies, United Healthcare, Blue Cross Blue Shield, Cigna, Aetna, and Humana. The big five. 850 million no's to doctor recommended treatment and testing. That is what you're dealing with. It's wrong. It never should have gotten this bad, but there's no accountability, no one to stop these insurance companies. Dr. Oz, in my opinion, useless. He's not going to do anything.
He's concerned about data analytics and improving computers in medicine.
Yeah, I don't know why Trump picked Dr. Oz, but that guy is a joke as far as I'm concerned. He's never done anything to really help people. He's full of shit is what he is as far as I'm concerned. You guys need real representation, someone who really cares about your well-being and doesn't bow down to the all-powerful insurance industry. That's my take on it. It makes me angry, folks, when I know you're being lied to by the insurance companies. They're cheating you. They're not just cheating you out of money, all right? It's one thing to be cheated out of money. It's another thing to be cheated out of your health and your money, all right? And that's what these insurance companies are doing. Yeah, I mean, I've done everything I can. I've just pioneered new technologies. I have literally 5 patents right now. 5. All right, I've been awarded 3 out of 5. The other 2, one of them, I'm still working on some additional claims, it's called. And then another one is very early in the patent process. Oh, look at that herniation, guys. Look at this thing. It's huge. Can you see this, Henry?
Yes, we can.
That's a good size one. There's another one right there. So I just pulled out a big piece of disc herniation out of the tear. Thank you, Luis. Anyway, point is, we have the technology now to cure back pain at Duke Spine. Other doctors don't. And if you want your back fixed, you got to come here. We offer a free MRI review. We don't even charge you for it. You get literally 20 minutes of my time. You get 10 minutes on Zoom, another 10 minutes of me figuring out what's going on with you through looking at your MRI. Okay? All you got to do is fill out our form. Put your name, your email, your phone number, just the basic stuff so we can contact you and schedule a Zoom call. All right? And we need your MRI. I got to be able to look at it. That plus the physical exam that I do on the Zoom call, and I can give you a diagnosis. What's causing your back pain? The average patient with chronic back pain has 4 causes. 4. And we looked at these, how many causes of back pain there are, and one cause, like one bad disc that causes back pain, one cause of back pain occurs in 8%. 8% of people. All right? 8%. We looked at 5,000 patients with chronic back pain. We studied them, our patients who had chronic back pain, and we looked at what their causes of chronic back pain were. And the disc injuries was the number 1 cause. So disc pain from a disc injury is the most common cause. 85% of all patients with chronic back pain have their main cause of pain is disc pain, 85%. Then 10% of patients, the main cause of pain is the facet joint, F-A-C-E-T joint. All right, Henry, why don't we show the audience how facet joints are so painful. By the way, that needle you're seeing down there is from the other side, the left side. Remember, we got to fix this disc from both sides. So that's the tip of the needle. You can see it inside the disc. It's just hiding underneath that piece of herniation right there. Okay? Audience, look at the tear, by the way. Look at that tear. You guys see the tear in the annulus? It's so obvious. Before you go, this is perfect, folks. Okay? If I move the tube a little bit to the right, you see the white stuff there? That is the annulus that's torn. I'll put the laser down there. That white fiber right there is torn annulus. The blue is herniation stuck in the tear. It should not be there. It is not normal. This should be a fiber that runs from left to right as a continuous fiber. Trauma tore it. Then he got the herniation, and now check this out. Look at the inflammation right there. That's inflammatory tissue. That's the source of his back pain. If I remove that, his pain goes away. And I just did. Isn't that amazing? This simple surgery, it's outpatient. There's really no bleeding. People go home an hour after surgery and go back to their normal life the next day. It is amazing. And we can literally cure 99.6% of back pain now with our treatments that are all done with tiny little incisions. All right, let's show the audience facet pain, how it happens, and then we'll take some more questions.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, great. Thanks, Henry. So from our video, you can see that the second most common cause of back pain is the facet joints. Just like the disc, they get injured with trauma, some type of a car accident or slip and fall or sports injury in your lifetime, and you get this sudden jolting of your spine, which tears the disc, but it also tears the capsule of the facet joint and allows the joint to wobble around and smacks the cartilage surface and smacks off pieces of cartilage from the joint. So over time, that joint gets arthritis or inflammation, which then causes horrible facet pain. They also get enlarged in a process called reactive sclerosis, where they basically remodel the bone and they get bigger and cause all kinds of pinched nerve issues. So my point is, the second most common cause of back pain is the facet joints, but they're fixable. And just like you saw in the video, the way we fix that pain, we get rid of it, is using our plasma wand with a procedure called the Duke plasma rhizotomy, another patented procedure at Duke Spine, where we go in and basically destroy the pain nerve to this painful facet joint. And that gets rid of your pain permanently. Now, it's different than a RFA rhizotomy, which is what everybody else does, because the RFA just doesn't cut through the nerve, the pain nerve. It just leaves it there, and the pain nerve recovers and the pain comes back. But with the Duke plasma rhizotomy, we permanently destroy the pain nerve. The Duke plasma rhizotomy is available for knee pain, hip pain, shoulder pain, from arthritis. It's also available for facet joint pain, SI joint pain, either cervical, thoracic, or lumbar. And we get people from all over the world that have these pain syndromes, and we fix them. We cure them with these treatments. So, all right, what questions do you have from the audience? We're almost done with this disc. You can see the epidural fat there at 12 o'clock. So I'm just putting the finishing touches on this one, and then we're going to move on to the third disc on the right, and then we'll go to the left side. He's got a lot of disc injuries. He's the maximum we can do, which is 5.
We have a lot of questions and comments. This is the most I've seen in in a while from our videos. And so this next one is going to be coming from, one moment, this next one is coming from Ramazan on YouTube.
Yes, Ramazan. Got your question, by the way, on YouTube. I answered it for you, Ramazan, about international insurance.
And talking about that, they said currently in the talks with the insurance company. Hopefully, I will be in Florida soon to relieve my neck and head pain. Looking forward to meeting you as soon as possible.
You're Ramazan. I thank you for participating. I thank you for learning about your options for fixing yourself and having the confidence in Duke Spine Institute. I look forward to meeting you as well. And I really hope your insurance, international insurance, covers your procedures. I know we've done I believe we've done a telemed. I don't remember if we just did one body part or more than one, but just make sure whatever you're coming for, we do our telemed first so that we can identify all your pain generators, okay? All right, next question.
Next question is coming from Tom once more on YouTube, asking, a doctor wants to set me up for for epidural shots every 3 to 4 months. Isn't that bad for me? And what are the side effects of these shots?
Yes. So thank you for typing your question in. Epidural are basically where the doctor sticks a needle into your spine, into the epidural space, which is the area just outside that dura, which is the white, thick membrane covering your nerves. And your spinal fluid is in there. And they're going to inject steroids just outside the nerve roots, okay? And it's a very, very common practice, and it can be done safely in 90% of the time. But it's that 10% that you got to be careful. If you have a doctor who, we just did an entire video on this. Henry, put the link. We had a doctor here. She was doing epidurals for literally 30 years. And the Board of Medicine just shut her down because she gave 20 patients hepatitis C virus because she was using dirty needles in her clinic. She was not sterilizing the needles properly. And her name is Dr. Lily Vopel. You can see it's real. It was in the news just a few weeks ago, and we did a reaction video to it. Henry will put that reaction video link down below. But the reason I'm saying this is an epidural can be done safely as long as you go to a really good clinic where you trust the doctors to take care of you and do what's best for you. But there's a lot of doctors now who are looking for shortcuts and they want to save money, and so they're reusing vials of medicine. They're from one patient to the next. They're reusing needles. And so these pain management doctors, a lot of them are just very greedy, and all they care about is money. And to make more money, they're reusing supplies from one patient to another, and they're putting your life and health at risk. Hepatitis C is a deadly virus. There's no cure for it. It destroys the inside of your body. It eats you alive from the inside. It basically causes inflammation of your liver and other organs, which then melts. That liver will melt over time, and you die. So, would I do epidurals? No. Would I do an epidural at Duke Spine Institute with my Dr. Patel? Absolutely. He's totally trustworthy. We have the best equipment in the world. We prioritize patients' health and well-being. We don't cut corners. We do everything the way it's supposed to. It requires that you travel here, which is a pain in the ass, but your life could depend on it. That's all I will say. Now, let's talk about steroids. They're injecting steroids. Do steroids do things? Yes, they reduce inflammation. That's why they inject them in your spine, to reduce the pain associated with inflammation. But they also have other effects. They raise your blood pressure. It will raise your blood pressure for weeks or months. It will also raise your blood sugar. So if you have diabetes, your sugar could get out of control. You could go into the 300s, 400s, and you could go to the hospital with an emergency. So yes, there are other problems like raised sugar, raised blood pressure. It could also cause what's called avascular necrosis of the femoral head, which is where your hip bone dissolves. It's a really weird thing that happens with steroid shots. So they're not benign. I would strongly recommend, instead of doing shots, you come to Duke Spine and get fixed, and then you won't need steroid shots anymore. All right, that would be my best advice.
This next one is coming from, I cannot understand the name, but they are from Taiwan, I believe. And
All
so
right.
they say, I agree, the traditional fusion surgery and disc replacement surgery are awful. Too many risks involved and too much money to be had.
Yeah.
I came to Taiwan because of the insurance companies in the USA. I got my life back here in Taiwan. I can walk pain-free after getting traditional therapy, tuina, acupuncture, acupressure, and ligament.
All right. Well, I'm happy for you that you're doing well. I don't really believe that those treatments work long-term for disc pain or facet pain, but if it's working for you, I'm very happy for you. So God bless, and I hope you stay well.
Next one coming from Hira, once more on YouTube, saying, we are working in Pakistan. I'm a neurosurgery resident. Here we have ability of lesion generator, a NOMED, but our professor doesn't know how to use it. Can you please demonstrate its use? In the next video, can you and also teach about it, its pros and cons, and isn't it dangerous if you accidentally touch a needle of opposite side with the laser? Can it cause burning along the needle track?
Yeah, great question. So let's talk about the laser and the needle first. No, the laser energy is delivered from that tip outside about 1 millimeter from the tip, and after 1 millimeter the energy dissipates completely and doesn't cause any effect. So the laser is completely safe. Even if it hits the other needle, it will melt the other needle, but it will not transmit electrical signal along the needle. So there is no risk of electricity. The laser is not an electrical discharge. It's basically electromagnetic radiation discharge. So it's not electrical, it's electromagnetic radiation. It's radiation. And it does not transmit along metal. It will melt the metal, but that's all. As far as a video on how to do radio frequency ablation, which is what you're asking me to do, we don't really recommend that treatment anymore. It's outdated. Even though it's the most commonly recommended treatment in the world for back pain, it doesn't work. Patients have to keep coming back and getting it done over and over again. So we stopped doing it for the most part. We're now doing the permanent treatment, which is the Duke plasma rhizotomy. We have lots of videos on Duke plasma rhizotomy you can watch. Shot? Is that it? All right, good. And they're on our YouTube channel, so you can see the Duke plasma rhizotomy. That's what I would recommend. But thanks for joining us. Next question.
Next question is coming from...
Before we take that, take a look here. Can you guys see the incision? We've done 2 discs already. We're starting the 3rd one. The incision is about 1 centimeter wide. You can see the dilator slides down the guide wire. We're heading up to the L2-3 disc now on the right side. L2-3 right approach. I'm going to put some numbing medicine for his fascia because the fascia is innervated and I don't want him uncomfortable. The more uncomfortable he is, the more anesthetic the anesthesiologist has to give him, which is not the safest way to control pain. It's better to control pain locally rather than cortically.
Next question is coming from the person from Taiwan, once more on YouTube.
Shot?
Asking, do you accept ACCSS Arizona Indigent Health Insurance?
No, it's not about us accepting it. We'll accept it. They just won't pay. So you're asking, will that insurance pay for your surgery? The answer is they will not pay. Would we accept it? Yes, of course we would accept it if they paid. The problem is they don't pay. So this whole accepting nonsense is something the insurance companies concocted to make doctors sound like they're bad. We'll accept it, but they won't pay. That's the problem. We'll accept payment from anybody. If Satan himself showed up with a bag of money to pay for your surgery, I'd accept it, right? I don't care who's paying as long as the bill is paid, and I'm not paying it out of my pocket. That's the main thing. I can't afford to pay for everybody's medical care. I don't have that kind of money. So I need people to pay for their medical care. If I were you, I would contact Jeff Bezos. Jeff Bezos or Elon Musk, or what's his name from Microsoft, Bill Gates. They have a foundation. They pay for medical care, medical treatments, and they may pay for yours. But I'm honestly poor. I mean, I have my money I've made, savings, but I don't have enough money to pay for other people's surgeries.
Next question coming from Ramazan on YouTube, once more.
Sure.
Asking, after cervical disc repair from your surgery, do we need to still continue physiotherapy or enjoy life the totally pain-free? If yes, need physio, how long to continue with that with the physio?
Yeah. So the answer, the question is, Dr. Duke, when you do the laser surgery, does the patient have to do physical therapy afterwards? The answer is no, absolutely not. No physical therapy. I don't want you going to physiotherapy. Will you have to do self-therapy? What is self-therapy? Self-therapy is basically where you go for a walk every day, and that is the only thing you're going to be doing. That's the only therapy I want my patients doing, is going for a walk. Walking is the best exercise. There is no need for physical therapy. There is no need for chiropractor. There's no need for pain meds. Our patients don't take painkillers afterwards. They take a muscle relaxer, that's all, called Robaxin. Great question. So no physiotherapy, just walking.
Next question coming from Katil on YouTube. Saying, hello, sir.
Hi.
I have a question. When
Sure.
you burn the outside gel, there is still a hole in the disc. Does it heal or that hole stays like that? Is there any risk gel comes out from that hole again?
Yeah, great question, Katil. Thanks for asking. So what we're removing is the jelly that is stuck in the tear in the wall of the disc. The wall of the disc is called the annulus. The tear in the wall is called the annular tear. And the only annular tears that cause pain are those in the back of the disc. The ones on the side and the front of the disc do not cause any symptoms at all. So the only annular tears that need to be fixed are the ones in the back of the disc, not the side, not the front. Now, when I go in and clean the tear with the laser and get rid of the herniation that's stuck in the tear, as well as the scar tissue and calcium, your body will seal that tear on its own after surgery, but it cannot do it by itself before surgery. It's trying to, but it's unable to. You see this blue thing right here? That is the herniation. That's part of it, not the whole thing, but that's part of it. I must remove this blue jelly right there. I must remove it to allow the annulus to seal. The body can't just dissolve that away. It's too big. Okay, it's too big. And that's the reason why people live with back pain for 30, 40, 50 years, because their body is trying to get rid of it, but it's too big. It would be like you eating an entire mountain in your lifetime. You can't eat a mountain. It's too big. Maybe you can eat a small dirt ball, but you're not going to eat an entire mountain. It's not possible. So because the job is too much for the body to handle, that's where the Duke laser disc repair comes in. I come in here and I remove this stuff, and then the jelly and the scar tissue, and then the patient's body will seal the disc itself. As far as more jelly leaking out, you can see the jelly is not liquid. It's hard, it's firm. It's more like silicone. Not liquid silicone, but silicone that's cured. It's rubbery and it's firm. So we call it a jelly, but it's not liquid jelly, it's more of a firm jelly. Let's show the video of how the Duke laser disc repair works.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that once the laser is used to clean out the tear, the body heals the tear. The tear will literally seal all the way back itself, and the body does that. It takes about 9 months to do. All right, we're just about finished at this disc. A little more inflammatory tissue over there. What I'm asking you is, will the new Boston laser pedals fit the old machine? Well, then we need to buy some more pedals. Are you understanding me?
I understand.
I would buy some more. Find them used, because if we lose the pedal,
Yeah,
there's no way to use the machine. Yeah, they're bastards for doing that. I mean, find some good prices. I want at least 10.
10 more?
10. Yeah.
I believe I can find it between 200 and 300 bucks.
Oh yeah, then 10.
So, okay.
Yeah. Remember, you got to think about what are the things they can do that can basically make our machine not work anymore. And you got to stock up on those things. All right? Because people are going to want to get rid of them, so they're going to be selling them used, hopefully for a good price, but not for long.
We might need, Dr. Duke, we might need another infusion pump. They stopped making this in the market.
Get the infusion pumps. Yeah. All right, any other questions?
Yes, we have a couple more questions. This next one is coming from Katil once more on YouTube,
Sure.
asking, Sir, how much for a 2-disc laser surgery?
Good question, Katil. I don't have that information. I don't deal with the pricing or the cost per patient. So what you need to do is, Henry will show you the link. Just fill it out, submit your MRI, let me review it with you, find out what's wrong, and then you will get a recommendation. I'm going to tell you, a lot of people think they need surgery on their disc when they actually don't. They have something else going on. So I can't tell you how many patients I've met with and talked to that tell me they need this disc or that disc fixed, and it turns out, and their MRI shows disc injuries, but it turns out their symptoms are not coming from the disc at all. It's coming from something else. So my advice to you is, let's make a diagnosis of the source of your symptoms before we go talking about the cost of surgery.
Next question coming from Hira once more on YouTube,
Sure.
asking, treating 3 discs together, can it cause listhesis/spine instability later and need fixation?
That's a great question. So the person is asking, if you do laser surgery on a disc, can it cause the bones to slip and require additional surgery later? The answer is no. And here's the reason. Listhesis is nothing to do with the disc. It has to do with the bones in the back called facets and what's called the pars, which is a piece of bone that holds the superior and inferior facet together. So when you have a fracture of the pars, a broken pars, that's when you get listhesis or slippage of the bones. It has nothing to do with a disc injury. And I don't recommend treatment of slippage anymore, because people with slippage that have pain their pain is not coming from the slippage, it's coming from the disc tear, the tear in the disc. So I stopped recommending fusions for people with listhesis unless they can't have the laser, in which case a fusion would be the next best thing. But when you do a fusion, you're not really treating, the pain isn't going away because you're fusing the listhesis. The reason the pain goes away is that you're removing the disc and you're taking the herniation out of the tear during the surgery. As long as you do inner body fusion.
Next.
And the laser, we've done now 2,600 patients in 19 years. We've never had somebody get listhesis from our surgery because we're not removing any bone or ligament from the spine. How's he doing? Good. You can keep the questions coming.
Next question coming from Frank, once more on YouTube.
Let me just finish the listhesis question. If you go and have a microdiscectomy or discectomy, you will develop listhesis afterwards. If you go and have a laminectomy, you will develop listhesis afterwards. It may take a year, it may take 2 years or 5 years, but your spine, because the surgeon is taking bones and ligaments out of your spine with laminectomy or with discectomy, your spine will start to slip forward. So I can't tell you, I've seen thousands of patients that had microdiscectomy, discectomy, laminectomy, and then they come see me afterwards because they have so much pain. Their surgeon took out the bones and ligaments during the discectomy or laminectomy, and now they have a listhesis, like grade 1 or grade 2 listhesis, where their bones are slipping because the surgeons take out your bones and ligaments that hold your spine together when they do laminectomy, okay? You all should know that. It's very important. The surgeons don't tell the patients that because they don't want the patients to say no to the surgeries that they do, right? Besides, if you're a spine surgeon, like many of these spine surgeons that do the old-fashioned fusions and stuff, they want your spine to slip so that you'll come back to them and get a fusion later on. So they're doing laminectomies on patients like you, and they're giving you the slippage by taking away bones and ligaments so that when you come back, you're going to be in pain and you're going to beg them for a fusion. They're corrupt, basically. I've seen it. Happens all the time. Very common practice. I don't do that because it's unethical, immoral. It goes against my code as a doctor to always do what's best for the patient. But these other doctors will do it. So be aware of that. I'm not saying every spine surgeon is bad, but some of them are, and you just got to be careful. They're trying to get more surgery out of you. More insurance payment. All right. We don't get insurance payments usually, so we have no motivation to do something like that. We just want you fixed. That's our goal at Duke Spine.
Next question coming from Frank, once more on YouTube.
Thank you, Henry.
Asking, after you repair the disc, will the disc regenerate, meaning to come back to its original thickness?
Yeah. So great question. The answer is the disc will regenerate, the annulus will regenerate, but the nucleus, the jelly in the middle, does not regenerate. But when you do the laser surgery, you're going to keep more jelly from coming out. So once the laser surgery is done, once this debridement is completed that you're watching right now, this wall is going to seal and then no more jelly will come out. So you're going to preserve and maintain the thickness that you have right now, but you're not going to have new jelly come. Remember, the jelly comes from the notochord, an embryological structure that disappears when you're before 9 months, before you're born, and that notochord becomes the nucleus. So you can't add more notochord as an adult. It's only there when you're a fetus. So you can't make more jelly. Now there's lots of companies trying to sell jelly to you, the patients, trying to convince you you need it, but do not buy it. Do not buy into that nonsense. It's going to be a big business for the future, but it's completely unnecessary and there will be complications. How do I know this? Because I know about the medical device companies' attempts in the past. They've been attempting for 50 years to make a jelly. And every time they make a jelly to put in, they do the testing and it explodes and comes out. It just doesn't work. It doesn't stay in there because there's so much force on the lower back, all this pressure and grinding and movement. Nobody's been able to find a jelly that stays inside. So, and you don't need it, by the way. People without jelly do great. They have a normal life as long as they have the Duke laser disc repair. All right, we're just about done with this disc, another 30 seconds, and then I'm going to move on to the patient's left side. We have a few discs to repair over there, 2 of them, and that will be next on my list. Any questions?
At this moment, no current questions, but we do have a comment coming from Hira once more on YouTube.
Sure.
Saying thank you so much, sir.
You're welcome. You're welcome. That's why I'm here to, I can do these surgeries and teach because after all, I'm not using my mouth to do the surgery, right? But I'm using my arms to do the surgery, my hands, my brain. But the parts of brain that I'm using to do surgery are different parts of brain than those that engage in conversation and teaching, okay? So I have, as Einstein says, we humans only use 20% of our brains at any given time. By teaching you guys, I'm getting to use more than 20%. I'm getting to use 21%. I'm just kidding. My attempt at humor. All right, so we're done with this disc. I'm going to show you something here. There's the tear. But let's go ahead and turn on the light, and we're done with this disc. I want to show you all the pieces of herniation that are here, okay, that have fallen out, okay? Let's do the irrigation. Can you guys see this, Henry? This is
Yes,
not
we do.
all of them. This is just some of them. You guys see that? Show the audience.
Yes, we do.
that. Those are all pieces of herniation that have come out of the tube, floated out, once I released them with the laser. And I took a bunch of other ones that I gave to Luis with the grabber. But these are all the small pieces. My estimate is there's about 30 herniations pieces in each herniated disc. So that's a lot. And there's a bunch more down here on the plastic. But that gives you an idea of what we're dealing with. It's not one piece. It's always lots of pieces. All right. I'm going to switch to the left. Any questions? Where's the stapler? I'm going to staple this closed so you guys can see before we do that. See how tiny the incision is?
Yes, we do.
Tiny. No hospital needed. No narcotics needed. No painkillers needed. Just a staple and a Band-Aid. That's it.
Next question is coming from Tom, once more on YouTube,
Sure.
asking, I have researched and seen some surgeons claim to be able to fill the hole in the disc with some sort of sealant. Are you familiar with that?
I hope I heard that right. Cement? Not,
Sealant.
oh, sealant. Yeah,
I did
sure.
not mean that way.
All right, great question. So one of our audience has made the point that he's seen some surgeons fill the disc with a sealant shot. Now, shot? Yeah, interesting. Hold on a second. I've got to push my guide wire through. Shot. All right, so we're not seeing enough of the disc. I need a little more disc, so please open the collimator anteriorly. Shot? Really?
Well, you have to move the patient out. Yeah. Raise the patient.
Man, oh, there we go. Oh my gosh. Sorry guys and gals. I'm trying to get this guide wire to stay in the disc because clearly the needle I did hit it with the laser from the other side, and it's really hard to get the needle out over the guide wire. It's grabbing the guide wire. Because typically when you hit a needle shot with the laser, it doesn't open the tip of the needle, making it wider. It narrows it because you're welding, right? I did, yeah. Let's, give me some. Do we have any alcohol? I'll take it.
Alcohol, please.
I mean, these are double gloved, right?
Yeah.
So I don't even know if it went through. Anyway, while we're waiting, put a little bit of alcohol on a 2x4 here. Put a little alcohol here. That's it. Good. Yeah. Alcohol is a wonderful antiseptic. And I'm putting this Raytech on the ground. I'm going to take one of my gloves off, my left, and I'm going to, left. Left. And I'm going to put a new left glove. Yeah, it did not go through the second glove. I always double glove because it's safer for the patient when the surgeon uses two gloves, because if you compromise the outer glove, you still have the inner glove that's sterile. So you don't give the patient any infection. I wouldn't grab it with that. You might not get the dilator down. Shot? Yeah, I think we're good there. Feel how powerful that is. All right, let me see if you've got it?
Well,
All right, you stay on it. I'm going to stay on it. I'm going to try to pull this off. There we go. Woo! So yeah, when you hit the tip of the needle with the laser inside the disc, it bends the metal, it melts it, contorts it, and then when you put the guide wire through, which you need to do, it makes it hard to get the needle off. But we're done. We did it. Now, the question was about putting a material in the disc.
Sealant, yes.
Yeah. So listen, folks.
Yeah.
I'm going to tell you the God's honest truth. Those sealants don't work. They're FDA approved. Let me tell you why they're FDA approved. They're FDA approved not because they work. The FDA doesn't give you approval of a device because it works. It gives you an approval of a device because it's safe. In other words, it won't harm the patient. So that disc seal material, I don't use it because it doesn't work. It's basically just a method for the company that sells it to become rich selling that stuff and make a lot of money even though it doesn't do what it's supposed to do. They won't guarantee you that it seals the disc. If you ask them for a guarantee, they won't offer it. Duke Spine Institute offers a guarantee. We guarantee that you'll be satisfied with our surgery, or we will continue to treat you with treatments that are reasonable and necessary until you are satisfied. It's called the Duke Spine Surgical Guarantee. We're the only spine company in the world that offers a guarantee that you'll be happy with the results. Okay? And you can read about it on our website. But we're the only company, we're the first to offer a guarantee, and we're the only spine center in the world to offer a guarantee that you'll be happy with your relief of your pain. How many companies offer a guarantee? Nobody. We're the only one. We've been offering it now for 10 years. Okay? To get the guarantee, all you got to do is pay the full price for the surgery, no discount. And if you get the guarantee and you have any issues, you come back and we fix it right away. No charge. Okay? So, it's available to anyone who wants it as long as you're having a treatment that we can cure your pain. Now, if we tell you you have 5 things wrong and you need 5 things fixed and you only do one of them, we're not giving you a guarantee, right? Because you didn't do the other 4 we asked you to do. So we know for sure you're coming back because those other 4 are going to hurt. So it would be stupid of us to give you a guarantee for treating one thing when you have 5 that need to be fixed. So just common sense, right? We don't want people gaming us. We just want honest to goodness, good results, and we're willing to stand behind our work. Any questions?
Yes, this next question is coming from Frank, once more on YouTube.
Yeah, so to answer the question, just as a summary, those injectable materials, all they do is make companies rich, but they don't fix your back. They don't work.
Question from Frank once more on YouTube asking, the workman's comp insurance company and the doctors forced me into having a C3 to C4 fusion. It's almost 1 year now. I still have all the pain and numbness and the clicking and grinding in my neck. Do you think they messed up my C3 to C4 fusion? I'm still having a lot of pain in my neck. Also, my MRI showed that I also have moderate stenosis in the C4-5, but he never addressed that, only C3 to C4. They said the C3 to C4 was crushing my spinal cord and also starting to swell. After the surgery, I will admit, though, I had some my mechanical ability come back, but I have lost my ability to write. Now I can write and take notes again since my surgery last July, but I still have all the numbness in my arms and hands and fingers.
Yeah. Well, I appreciate the very long question. It's very complex, and I'll do my best to answer it for you. So first of all, you have to understand, everybody needs to understand something. If you go to a spine surgeon and say, I want you to do surgery to cure my neck pain or my back pain, they will escort you to the front door and tell you to leave, because they will say surgery does not cure back or neck pain. Duke Spine Institute is literally the only surgery place in the world that says it does cure back and neck pain. That's because the other doctors do not know the source of back and neck pain. We do at Duke Spine. Duke Spine knows the source of your back and neck pain. All I've got to do is examine you and look at your MRI to know where the pain is coming from. But we're unique in the entire world in that we can offer a cure to back and neck pain because we can identify the source in every single patient that we interview, that we examine. Okay? That's why we offer a free MRI review, is because we can identify the source of back and neck pain. Other surgeons cannot. So when the surgeons do surgery, they're not doing it for back pain and neck pain. They're not supposed to, at least. They're doing it for what's called neurological deficits. And whoa, watch it. What are neurological deficits? Well, there's three things that can be damaged in your body that are neurological. The first is your brain, the second is your spinal cord, and the third is your nerves, your peripheral nerves, okay? And when you have your spinal cord crushed by a disc herniation, the neurosurgeon is going to do surgery to unpinch the spinal cord. At least that's what they're supposed to do. They're not doing surgery to fix your neck pain. If you ask them, is my neck pain going to go away? They will tell you no. You go to pain management to get your neck pain treated after surgery. They're doing your surgery to unpinch the spinal cord and the nerve. At Duke Spine Institute, we are very different than everyone else. We do surgery to cure your pain and to unpinch spinal cords and nerves. We do it all. So while they only do spine surgery to unpinch your spinal cord and nerves, we do spine surgery to unpinch your spinal cord and nerves and cure neck and back pain. So we're the only ones in the world that do that. Now, did your surgeon do anything wrong by only fixing the C3-4? Well, if the C3-4 was where your spinal cord was being crushed and the C4-5 is not, then your surgeon did a reasonable surgery. It's not what I would do. I would have fixed both. But some surgeons are scared to fix both discs because the more discs they operate on, the more chance the patient has of getting a complication. And surgeons don't like complications. That's a universal truth. That is one thing that is true. Some surgeons will do both discs because they are confident they can fix both at the same time and not get a complication. That would be me. But other surgeons are scared to do more than one disc because the one disc surgery takes 4 hours for them and the 2 disc surgery will take 8 hours. And the patient will have a complication for sure. Now, when I do 2 discs fusion, it takes me 1 hour to do both. Why? Because I'm extremely talented and very, very skilled and experienced. That is the truth. Okay? Because of my 1,000 ACDF surgeries I've done in my career, I can do an ACDF 2 level in 1 hour. And I can do it perfectly without any complications. But not every surgeon can do what I do. Not all surgeons are created equal. That is absolutely true. Not all surgeons are created equal. All right, good question. I hope I answered that for you. If I were you, I would get a new MRI. I would get an X-ray. Ask your doctor for both. They need to get it for you. And then I would fill out the Duke Spine free MRI review form online on our website. And I will look at your MRI and X-ray with you. And I will tell you exactly what should be done to fix you. And all of that for free. We don't charge you unless you don't show up. If you don't show up and you want to come back and get it done, then we are charging you. That's the only time we charge people, is if they don't show for their appointment. I mean, honestly, right? I'm sure everybody would agree. You have a neurosurgeon willing to do a free appointment for you for 10 minutes, 15 minutes, and you don't show up, and then you want to come back and do it later. Of course, we're going to charge you $100 for that. $100 is still a good price. Okay, it's very fair, very reasonable. But we do have real costs. Our employees don't work for free. They charge me. I just don't charge you. All right, lots of good questions. We're almost done with this disc. We've got one more to go and we'll be done. Any questions for me?
As of now, one more question coming from Pure Honest, Very Caring on Facebook.
Oh, thank you. Thank you. Thank you. Thank you. Yeah, we are that. Duke Spine is exactly those qualities: pure, honest, and very caring. We care about you, the people, because that's why I went into medicine. I went into medicine to help people with their illnesses, to get rid of them. Unfortunately, a lot of doctors don't go into medicine for that reason. And honestly, medicine is complicated, right? You got a lot of these. Okay, look, the medicine used to be what's called the doctor-patient relationship, right, Henry?
Yeah.
What does that mean, doctor-patient relationship? Well, that phrase sums it up. It's between the doctor and the patient. That's it. And there was a reason for that phrase. What it says is the doctor, the patient, that's all that matters, is the doctor and the patient. That your border is the doctor and the patient. But since, that phrase was coined many, many years ago about the doctor and the patient, now there's other companies that manufacture devices like pacemakers, defibrillators, screws, rods, artificial discs, spinal cord stimulators. These companies have interposed themselves into the doctor-patient relationship, where now it's the doctor, implant company, medical device company, patient relationship, right? And now we also have insurance companies that don't want to pay for medical care. So it becomes the doctor, insurance company, medical device manufacturer, patient relationship. That's how most doctors are, but not me. I refuse to accept that. And I always believe you have to do what's best for the patient. And if the medical device companies are making things that are legitimately best for the patient, then we'll use them. We use technology at Duke Spine. We have lasers that are made, and we use them because they're good for the patient. We have anesthesia machines that are good for the patient. We use them. We have fiber optic scopes and endoscopes. We use them because they're good for the patient. But everything we use must be good for the patient. Otherwise, we won't use it. Other doctors use what they're told to use and what they're influence, paid to use. Yeah, paid to use. So they're bought and sold by the companies or the insurance company. Would it surprise you to know the largest commercial insurer in America is, anybody know? United Healthcare, right? And that guy is going to trial. I think he's going to trial this week or next week, right? Mangiaroni or whatever his name was. Henry?
Luigi Mangione.
Yeah, his trial is, I think, next week, right? Or the week after. Point is, he shot and killed the CEO of United Healthcare, the largest insurance company in the world, right? Besides Medicare. But I'm going to tell you something. United Healthcare has bought up hospitals around our country. They now own the hospitals, and they've bought up doctors. United Healthcare Group now has 100,000 doctors. Now, there's only 1 million doctors in America, 1 million, and 100,000 or 10% are now controlled by an insurance company, United Healthcare Group. What do you think those doctors are going to recommend for somebody with back pain? If you work for United Healthcare, they're going to recommend Advil. Did you say Fusion? Oh my God. They're going to recommend, go get a lead injection, okay? Go get a gun, put some bullets in it, and give yourself an injection of lead. Why? Because if they recommend surgery to a United Healthcare beneficiary at their hospital when they work for United Healthcare, they're going to lose their job. They're going to go under review, right? They're going to be under review. Their peers are going to pull them into a room with dark room and say, you recommended an expensive treatment, you're going to cost the insurance company money. But they'll never say it like that. They're going to say it like this. You're recommending spine surgery. What proof do you have that it's going to work? Well, nobody has proof that it's going to work, right? Nobody. So they're going to say you should be recommending over-the-counter Advil. And the real reason is to save the insurance company money so they can make more profit. But for the patient, they're going to suffer. That's where we're headed. 10% of our doctors in America are owned by an insurance company called United Healthcare Group. Okay? It is bad. It is really bad when the doctors are being owned by the insurance company.
Question from Pure Honest, very caring on Facebook.
I will go and work at McDonald's and flip burgers before I work for an insurance company that is motivated to harm patients to make more profit. That's what these insurance companies are. Okay? I've seen it. I know how they work. They are manipulating the data. They're forcing the hospitals to get electronic medical records like Epic, and then they're using data to basically deny treatments by doctors that will actually help the patient but cost the insurance company money. That's where we're going. And I'm telling you about it because I can't fix it myself, but you people can. Grassroots effort. That's what it takes. Come on in. Yes, I'll take the question.
Pure Honest asking, what is the next step if they couldn't locate the S1 discectomy during the L4-L5 S1 discectomy, minimally invasive endoscopic surgery, and the lumbar and cervical bilateral decompression herniation removals and repair discs? They basically couldn't locate the S1 disc, so what is the next step to fill it in, and what are the reasons why they couldn't locate it?
Yeah. Okay, well, number one, incompetence. Number two, incompetence. Number three, incompetence. There is no good reason, acceptable reason, that a surgeon cannot locate a disc, L5-S1. All right, but there are a lot of bad, incompetent surgeons out there. And they will, oh yeah, you want me to staple it? Fine. And they will give you excuses. Now, have I been able to, I'm a very good surgeon, have I been able to do every single thing I plan to do in surgery? There have been times I was not able to. For example, I have patients who have really big facet joints, and I could not get to, I got it, Luis, I could not get to the L5-S1 disc because of that. But I always tell the patients ahead of time, there's a small chance that I can't get to that disc at L5-S1 through the foramen. But when you're doing an open surgery, like a laminectomy, there's no reason you can't get to L5-S1. What I can tell you is incompetence, or basically they chose not to do it because maybe it was getting late and they had a tea time at 4 o'clock and they had to make their golf tea time. But there's no real reason why the surgeon cannot get to L5-S1 or find L5-S1, right? It's just they've given you what I call a bullshit, nonsense, made up reason that isn't real, okay? not being able to find a disc that's in your spine, I mean, I've never heard of that. I mean, I've heard of it, but not legitimately heard of it. It's always a lie to the patient. These surgeons lie to patients all the time. I have patients that not my patients, but I've seen patients in clinic, like you, that have surgery elsewhere, and then they come out and their nerve is damaged during surgery by the surgeon, like literally ripped apart by the surgeon accidentally. Not on purpose, but accidentally, okay? And they can't move their leg afterwards. They have literally paralyzed leg. And then they come see me to find out what can be done. And I ask them what happened, and they say, well, the surgeon said the nerve was being pinched really bad, and it did some damage from the nerve being pinched, and it got, they did the best they could. But the patient went in there normal. They come out with nerve damage from the surgeon. That's not because the nerve was tightly bound around the disc. Okay, another example is spinal fluid leak. Patients come out of surgery with a spinal fluid leak, and the surgeon gives them they don't even tell the patients half the time that they got a spinal fluid leak. They leave that out. Like, I can see they had a spinal fluid leak from the surgery, and I ask the patient, did the surgeon tell you they had a spinal fluid leak? And they say no. They never mention anything. I'm like, well, you can see it on the MRI. You got a bunch of spinal fluid there. Plus they had a headache afterwards, right? So these surgeons, a lot of times, do not tell patients about the complications they had. And in your case, maybe they just got tired and maybe had a tee off or a dinner or something, cocktail hour at the bar, and they just told you they couldn't find the disc. But, I mean, I don't know. It's like you going home and having a 3-bedroom house and not being able to find the 3rd bedroom. It doesn't make any sense. Okay? So I think it's an excuse. We are on the last disc. We've done 4. This is the 5th. It's been a long surgery. I'm tired. I've got a tea time this afternoon. I could just tell this patient, we did the best we could and we couldn't find the L4-5 disc on the left. And the patient would believe me, by the way. He would believe me. I mean, that's how trusting these patients are. They trust me. And they know that I could do that, but I would never do that because the patient trusts me. That's the whole point. When someone trusts you with their life and health, you don't lie to them. You be honest with them. Tell them the truth. If I can't get to one of the discs, I'm going to tell the patient I couldn't get to one of the discs. And the surgery video is going to show I couldn't get to it. And it's also going to show that I tried my best to get to it. That's what the video will show, is that I tried my best. And that if I tried to do anything else, it would just hurt the patient. I'm not going to hurt the patient, not intentionally. I would rather not get to one of my 5 discs and not harm the patient. But I will try my best every time. All right, that's me. That's the kind of person I am. Like I always say, good people make good surgeons. Good people make good employees. The people I surround myself here at the surgery center, all of my employees are amazing people. They're good people. They're the kind of people who would literally, if you had a problem, you call them, they would leave their house at 12 o'clock at night and come help you. That's the kind of people they are. Not just because I'm their boss. As a matter of fact, they may be less inclined to do it because I'm their boss. But they would do it for each other because they're good people. That's the kind of people that works at Duke Spine. I don't just hire garbage, and I don't keep garbage people. I think there's a lot of bad people out there, and I don't hire them and I don't keep them. If they sneak past me in the hiring, I'll find out, and they'll be gone.
As of now, our last question coming from Charlie, once more on YouTube, asking, after ruling out neuropathy, a neurologist and I discussed possible sources of my bilateral paresthesia and pain. He at one point said he's not sure why piriformis syndrome is real. Why would he think that?
Great question. So the question, I like to repeat questions so the audience can hear it. Thank you, Henry. You're very clear on it. This person is saying, Dr. Duke, I have piriformis syndrome, but my neurologist doesn't believe it's real. So why is that? Well, look, I mean, the truth is that doctors differ in their education, their intelligence, their knowledge and experience. Okay? Think about that for a moment. All doctors differ in their intelligence. Now, most doctors are pretty damn intelligent, but some are far more intelligent than others. Okay? Doctors differ in their intelligence, their knowledge, which is what you learn practicing medicine and before you practice medicine while you're in medical school. Experience, which is not just medical experience, but your life's experiences, all your life, right, from when you were a kid. And ability. So there are differences in doctors. And because of that, you're going to get different opinions. What you want is you want a doctor who will fix your problem, if it's fixable. And that's what Duke Spine Institute offers. We cure back pain and neck pain, sciatic pain, radiculopathy, when it comes from the piriformis syndrome and when it comes from the spine. Okay? There are other causes of paresthesias and weakness in the legs, right? There's lots of causes, but most of those causes are very rare. There's one of those causes, for example, if you have cancer in your pelvis, like uterine cancer, prostate cancer, it can grow around those nerves that are heading down to your feet, and it can cause those kind of symptoms. And the neurologist would have to get an MRI of your pelvis to find it. Okay? But if I've diagnosed you with piriformis syndrome, then you have piriformis syndrome and you need to get it fixed. And you need to stop messing around with other doctors and just come and get it done. We are almost finished. But since somebody brought up piriformis syndrome, I think it's all fair for us to teach the audience what piriformis syndrome is and how we fix it at Duke Spine.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, we're wrapping up the surgery. I'll take the last questions in a minute, but I want you all to look. The laser fiber is 1 millimeter wide. Look at the pink color right here in the annular tear. That is the inflammatory tissue I talk about all the time. That's where the back pain comes from. We just zapped it away. There is nothing else you can do to get rid of the back pain but zap away that tissue. And the laser is the most advanced tool in the world to do this. Nothing else even comes close. The laser is your very best tool There's no other tool that works. There's no other tool that's as safe as the laser. There's no other tool that's as long lasting as a laser. The laser gives you a permanent pain relief when it comes from the disc. Okay? You can see the laser uses two things. It delivers very powerful energy from the tip of the glass fiber, laser energy, which is electromagnetic radiation, delivers it to this abnormal tissue, and it breaks it into little pieces, which you guys saw some of those fragments earlier. But the laser is the best tool. Now remember, that's 1 millimeter, and you can see the precision of the laser is sub-millimeter precision. I can control this laser so it only delivers, if you take a millimeter and cut it into 20 pieces, it's 1/20th of a millimeter. I can use this laser to 1/20th of a millimeter precision. That's what I can do using the endoscope. So, don't believe articles and videos by nonsense doctors who lie to you to keep your business. Come and get the best surgery in the world to get rid of your back pain. We've got 30 seconds left. What questions do we have?
This one of the two questions coming from Ping on Facebook.
Ping, hi, welcome.
Asking, have you had many or any celebrities contact the clinic for the DLDR?
Oh yeah, we have. We've had famous people have DLDR. I cannot discuss them with you because they have privacy, and it's against the law for me to mention their names. But you can see on our testimonial section, if you go to the YouTube channel, Henry will put a link. We have hundreds and hundreds of patient testimonials for our surgery. You might find somebody famous in there.
Then last but not least, coming from Frank, once more on YouTube.
All right, Frank, welcome.
Asking, does the Duke Spine Institute also perform ankle and shoulder replacement surgeries?
Frank, thank you for asking. Great question. But here's the thing. We are beyond replacements of ankles and shoulders. We have next gen technology. It's called the Duke Plasma Rhizotomy. It's patented, and we can eliminate ankle pain. We can eliminate shoulder pain without putting you through a replacement. It's actually an outpatient procedure. It takes 20 minutes to do. Henry, we have the video for the knee available, right?
I believe so. Let me check. Yep. Yes,
Why
we do.
don't you show Frank the DPR, which we do for the ankle and the shoulder. Show it to him for the knee. I don't have the shoulder done yet, and I don't have an ankle done yet, but I have a knee, and it's the same principle. The shoulder has 4 pain nerves, and we go in and kill those 4 pain nerves with our Plasma 1.